Hi everyone, and welcome to the exam review for an exploration of stress reactivity, mindfulness meditation, and prayer through heart rate variability. This is going to be based around the slides that you've already been provided with and trying to highlight the key points so you can prepare for the exam and make sure that you understand the most important parts of the course material. So in the background, we know that chronic stress is a very significant problem all around the world, in North American society, Western society in particular. And we know that some of the ways that that is manifested is through heart rate variability. And we know that the outcomes of long-term stress can be cardiovascular disease, more chronic illness, a variety of negative health outcomes, and so it's appropriate to look at ways to reduce stress, including mindfulness meditation, prayer, and obviously a wide variety of other stress-reducing activities. We know that stress can lead to the onset and progression of physical and mental health disorders, and a majority of primary care visits, that's visits to family doctors, are related to stress in one way or another. Almost a quarter of Canadians in a 2013 survey rated most days as being stressful or quite a bit stressful. And these stress experiences are manifested in the body in the way that the two competing sort of halves of the nervous system relate to one another. The sympathetic nervous system, which is related to active fight or flight, and the parasympathetic nervous system, which is activated during relaxation or, as we say, rest and digest. You can also think of it as parasympathetic being sort of paralyze, slow down, and sympathetic, starting with an S, like stimulate. So these are anatomically and functionally divided nervous pathways, and they have sort of opposite functions. And when there's a stress-related disorder, there's an imbalance in the activity of these two functions. So during activation of the fight or flight systems, the heart rate's elevated, there are stress hormones released, your body is ready for taking action, whether that's running away from a predator or getting into a fight to defend yourself. But in the modern context, the overactivation of this sympathetic nervous system is triggered by chronic stress. Your body doesn't necessarily have a good way to identify, potentially lethal stress-inducing conditions that deserve that response from everyday nervousness and the challenges of modern living. Much of this balance is reflected in a faster versus a slower heart rate. And the vagus nerve is the neuroanatomical structure that has the key role in switching your body from sympathetic to parasympathetic activation at the appropriate times. The vagus nerve is activated and triggers parasympathetic dominance whenever we are breathing outward. And in particular, with slower, longer breaths outward, we increase the vagus nerve's influence in activating the parasympathetic nervous system. The vagus nerve is actually the longest nerve of the autonomic nervous system in the human body, and it has a lot of influence along with the heart, lungs, esophagus, liver, other organs. And it's why this is so important is how we talk about stress coping. So the way that we use this parasympathetic activation during meditation is we slow the breathing, slow the neural activation, and get the body to calm down and slow the heart rate, and allows these systems to come back into balance. Another marker of activity in the autonomic nervous system is heart rate variability. So essentially we're just looking at What is the time between heartbeats, and how much does that time between heartbeats change at rest? So if that variable is relatively static, and we're just seeing, more or less the same number over and over again, that indicates that the parasympathetic nervous system most likely is getting its way, in the sense that there is not the kind of push and pull that we would expect to see when the parasympathetic and sympathetic nervous systems are in balance. Lacking that balance means that it indicates a need to intervene, most likely with stress and with other influences that are resulting in the elevated activation of the sympathetic nervous system. So the system is not counterbalancing itself in the ways that it should be for healthy functioning. So what we can see is that the heart rate variability changes in terms with the exhalation of the breath. So we can see that there's a normal increase in heart rate during the moment of inhalation and a decrease in heart rate during the exhalation. So this is to say these are really micro scale changes within the 1 or 2 seconds that you're breathing in and the 1 or 2 seconds that you're breathing out at rest, that there are small changes. And this is a really good indicator that you can see how the control of the breath in meditation and similar practices can be influential on the heart rate. So decreased heart rate variability can be understood as a lack of responsiveness to the changes that are asked for or expected by the body. In this case, what we can see is that in contrast to the previous slide, where there was a smooth responsive curve of these small heart rate changes as you inhale and exhale, there's a spikier change that there's some interference, some almost static between the two systems that is resulting in a relatively irregular heart rate and a heart rate that's not as well coordinated with your breathing. Now, there's evidence that decreased heart rate variability over the long term is associated with an increased risk of cardiovascular mortality, depression, anxiety disorders, and a higher HRV, higher variability. Again, this is thinking of it as more adaptability, more responsiveness to demand of the nervous system. Is associated with better attention regulation, more parasympathetic activation, lower stress, and can be a result of these mindfulness meditation practices and other stress-reducing interventions. So this is partly why we advocate for mindfulness as a stress reduction intervention and as a tool for healthy living. We have a understanding of this pathway where these effects are coming from and why this particular intervention is likely to have a positive effect. That focus, mind wandering, focus on the breath, that control and neuroinhibitory effect is really helping to influence that parasympathetic pathway. And so one of the things that our lab has been involved with in the last few years is trying to better understand how this works in practice and in terms of where the specific benefits are coming from. So why might prayer be similar to meditation in terms of generating healthier, increased variability of heart rate? The key similarity is the attention focus in the present moment, in the body, in the breath, and the not necessarily avoidance, but focus on that moment as opposed to worrying about the future or reminiscing about the past, a lot of other mind-wandering things that allow you to find more stressful triggers, where when you are in a meditative posture, a meditative focus, ideally, there are fewer stressful interactions that you are going to be processing. And while prayer is not obviously precisely the same as a mindfulness meditation practice, that similarity of attention focused in the present moment and on depending on what type of prayer you're engaged with, a communication with a higher power, this may be the cause of similar um, physiological and psychological benefits of improved autonomic nervous system balance. So where mindfulness meditation is a more secular practice and prayer is oriented around a different, obviously, religious focus around a relationship with a God or a higher power, that focus in the present moment is something that overlaps between the two. And while other forms of meditation that use perhaps mantras or other focusing tools rather than the breath might be more easily comparable to prayer, this study that we're going to be talking about looked at the use of those two techniques and to see whether the outcomes were similar. So one of our master students from a couple of years ago, Ikra Ashfaq, came up with this study, and in collaboration with Dr. Ritvo, they designed this experiment. And she thought it was of personal interest to her, and she thought that there were Islamic students at York who would be motivated to participate. And the objective of this project was to find out, was mindfulness meditation effective at increasing the heart rate variability, like improving the heart rate variability after a period of stress induction. So essentially we had to stress the students out before we could find out whether this meditation would help them calm down again. And also, is listening to a prayer similarly effective at increasing heart rate variability after a period of stress? And what do the differences between those two techniques look like? So this was a randomized controlled trial. So while we're going to go into a bit of detail about how the study was designed and run, don't focus too much on the specific methods and statistical processes in particular, but I just want to make sure that you understand the concept and the outcomes, the key findings from the study, similar to what you'd be doing with any of the other studies that we're going to be talking about. So they invited York undergraduate students from 15 to 29 years old who identified themselves as Muslim. They were excluded subjects who were diagnosed with any cardiovascular or psychiatric conditions and had a history of mindfulness meditation practice. Essentially, the objective was that they would be self-identifying as Muslim and would be experienced with the prayer, but not experienced with the meditation. So participants were introduced to the study, were given a baseline questionnaire, and then participated in a stress increasing intervention. Then the heart rate variability would be measured before and after that, as well as after the relaxation phase. So you don't need to know too much about the stress induction activity in particular. Essentially, participants were asked to identify a pattern and guess how that pattern should be finished. So they would be given, for example, this 14, 38, 88, 140, 400, and then shown true or false, asked to identify which was which. However, as you can see, these patterns are not particularly obvious. And the true deceptive nature of the intervention, unfortunately, was that the response was fixed. You would just be told 50% of your guesses were right and 50% were wrong. It was your actual attempts to answer had no bearing on whether you were told it was correct or not. And so understandably, this is a relatively stress-inducing task because people don't understand what they're doing and how that relates to the results that they're getting, which in a way is analogous to daily living. If you are in a stressful environment at work where sometimes your productivity is praised and other times you hear complaints without necessarily understanding why you're getting these different types of feedback, it's a very unnerving situation. So after the stress-inducing task, there was a post-stress phase where a variety of the interventions were used to try and calm people back down. There were 4 different forms of stress reduction assistance involving mindfulness and prayer, and a control procedure that was a description of mindfulness rather than a mindfulness session itself, and a description of prayer instead of actually listening to a prayer recitation. And the idea behind these controls is that you need something that draws the attention and will have your participant focused, but ideally that is not giving the actual benefits of the treatment condition. I'm going to go through these quickly, but you can read these on Moodle at your leisure. So this is just explaining how many participants were recruited for the study and how they were stratified through the different groups, and how many were excluded for various reasons. You don't really have to remember any of the details of this, except for 65% of the participants were females, and the majority of participants were relatively religious Muslim individuals. So as described, the study was divided into a stress induction and reactivity phase, and then a stress recovery phase. That was divided into 2 5-minute subphases. The main hypothesis being tested was that HRV would be lower during the stress reactivity phase, and that would indicate that the stress induction was effective. So again, the HRV going down is sort of saying heart rate was less responsive. And then that HRV would be higher during the stress recovery phase to say that it would improve and become more responsive as the stress levels went down and the parasympathetic and sympathetic nervous systems got back into balance. So before conducting the analyses, participants were split into 2 groups according to self-reported gender. In the past, studies have shown that females are more reactive to this type of stress-inductive experiment than males are. So in order to have the statistics reflect that, the analyses were conducted with the 2 groups separated. Now, this is not a course in statistics. You don't have to understand these analyses, but you do need to understand the results. So this slide is just reiterating that the key hypothesis is to say that the experimental heart rate would be better than the heart rate variability in the control condition, and that these differences would be noticeable in both males and females. So I'm going to gloss over the statistical processes here. But what we can see is that there are statistically significant differences between the experimental and the control groups. So this is suggesting that, in fact, the experimental condition was more effective at reducing stress than the non-experimental condition. And while on the previous slide we saw in males at both the 1 to 5 and 6 to 10 minute phase, there was that statistical difference. In female participants, it appears that there was a significant difference at the 1 to 5 minute phase, but not in the 6 to 10 minute phase. And now for comparison, this is during the prayer intervention. So we can see that there's a trend that is similar, that the experimental group was showing improved variability, but these failed to reach statistical significance. And in the female prayer group, it looks like there was a statistically significant difference during the stress intervention for heart rate variability, but not afterwards. So the final hypothesis being tested was comparing the meditation to the prayer intervention. And so this would suggest that at the post-stress intervention phase, or rather stress induction phase, that participants in the meditation group would not display statistically significant differences in heart rate variability compared to the participants in the prayer group. And what we found is that meditation was in fact associated with improved heart rate variability relative to the prayer group in males, whereas in the female participants there was no significance found at either of the post-stress time points. Now, the lack of finding for improved HRV, increased HRV associated with prayer, prompted another analysis where we asked the question of whether people who were more distressed or depressed were more responsive to prayer than people who were less distressed. So to test this, we used the ATQ questionnaire, and those who had an ATQ over 60 were termed dysphoric, meaning anxious or restless, while those who were below the cutoff of 60 were considered to be in a healthier mood state. So this was the additional hypothesis that at the post-stress induction phase, were the participants with the higher baseline stress, higher negative automatic thoughts, any better off than participants who started without those higher levels of distress? So using that 60 score cutoff on the ATQ questionnaire, so what we found is that among the female participants with this high baseline stress condition, in the first few minutes after the meditation intervention, there was a more substantial impact, but not at the 10-minute mark. And for the prayer intervention, within the first few minutes, there was no significance, and at the 10-minute mark, there appears to have been a significant difference. So it's not entirely clear what the reason for these differences would have been, but it's something that we'll continue to look into. Conversely, among the participants who had a low baseline stress, low baseline automatic thoughts, there was essentially almost no difference between the experimental and the control groups in the first few minutes after meditation. And similarly, in the minutes after prayer, this difference again didn't manifest. So this is suggestive that in order for your heart rate variability to fluctuate in a positive direction, you need to have a certain baseline level of distress in order for this type of self-soothing activity to have distress available to reduce and improve. So the highlights. Stress induction did decrease heart rate variability as expected. Mindfulness meditation increased heart rate variability, improved in both males and females. And prayer temporarily increased heart rate variability in males and females with dysphoric mood. Mindfulness meditation globally increased heart rate variability, and prayer increased heart rate variability to a lesser extent. So, the implications of the study. It looks like there are useful effects from both mindfulness meditation and listening to prayer, and they can be used for stress reduction programs and therapies. Now, the mindfulness meditation showed more significant and faster, earlier variability improvements than listening to a prayer, but individuals could adopt elements of mindfulness meditation into their prayer. For example, synchronizing in and out breaths with prayer verses, and mindfulness practice before prayer could enhance the overall HRV effects from prayer itself. The major limitations of the study were a limited population. There are Muslim individuals who were relatively religious, and we had a fairly small number of male participants with respect to the high and low baseline stress conditions. So there was really too few male participants to test their responses based on distress levels, as was done in the female group. In the future, this will probably be expanded to test more specifically within clinical populations, so people with ongoing anxiety and depression issues, and using periods of recovery longer than 10 minutes to find out whether people need a longer period to warm up to the recovery process. However, as we've seen for most of the people that were in this study, 10 minutes of mindfulness did result in a significant improvement in HRV, meaning that the heartbeat was in a more responsive and healthier condition. Thanks, everybody. Hope this lecture was helpful, and we'll see you back for the next one.